Have you ever wondered if a medication sitting in your medicine cabinet right now could be quietly damaging your memory? What if some of the most commonly prescribed drugs in the world were increasing your risk of confusion, cognitive decline, or even dementia-like symptoms? Millions of people take medications every day to help them sleep, control allergies, manage pain, calm anxiety, or treat bladder problems. But very few are warned about the potential effects these drugs can have on the brain. Today's discussion could change the way you look at your medications forever. We are going to uncover 9 popular medications that researchers and medical experts have linked to memory problems, impaired thinking, and a faster decline in cognitive function, especially in older adults. Some of these medications are so common that many people take them without a second thought, yet the effects may build slowly over time, making it difficult to recognize the connection between the drug and the symptoms. If you or someone you love has been experiencing forgetfulness, difficulty concentrating, mental fog, confusion, or unexplained changes in thinking, this information is especially important. Understanding which medications may contribute to these problems could help you have a more informed conversation with your healthcare provider and potentially protect your long-term brain health. Make sure you stay until the very end, because the final medications on our list are among the most widely used, and many people taking them have no idea they may be affecting memory and cognitive performance. The information you learn today could help you recognize hidden risks, make safer choices, and take important steps to keep your brain healthier for years to come. Memory loss is often blamed on aging, stress, lack of sleep, or even genetics, but there is another factor that many people never consider: the medications they take every day. Some of the most commonly used prescription and over-the-counter drugs have been associated with changes in memory, concentration, and overall cognitive function. While these medications can be highly effective for treating certain health conditions, their effects on the brain may sometimes go unnoticed for months or even years. This is especially concerning because the symptoms often develop gradually, making it difficult to connect them to a medication that has become part of a daily routine. Researchers have found that certain medications can interfere with important chemical messengers in the brain that are responsible for learning, memory formation, attention, and clear thinking. When these chemical pathways are disrupted, people may begin to experience mental fog, forgetfulness, confusion, difficulty finding words, trouble focusing on conversations, or problems completing familiar tasks. In some cases, family members may notice changes before the individual recognizes them. These cognitive effects can be particularly significant in older adults because the aging brain is often more sensitive to medication-related side effects. Another important concern is that many people take multiple medications at the same time. Even when each drug is considered safe on its own, the combined effect may place additional stress on brain function. The risk can increase further when medications are used for long periods or at higher doses than necessary. Understanding this hidden connection between common medications and memory problems is not about creating fear or encouraging anyone to stop prescribed treatments. It is about awareness, informed decision-making, recognizing potential warning signs early, discussing concerns with healthcare professionals, evaluating medication risks and benefits carefully, identifying safer alternatives when appropriate, protecting cognitive health throughout the aging process. The human brain relies on a complex network of chemical messengers known as neurotransmitters to regulate memory, learning, focus, mood, and decision-making. Every thought, memory, and action depends on these signals being transmitted accurately between brain cells. Certain medications, however, can interfere with this delicate communication system. While these drugs may be effective in treating specific medical conditions, they can sometimes produce unintended effects on cognitive function, particularly when used over long periods or in older adults. One of the most important neurotransmitters involved in memory is acetylcholine. This chemical plays a vital role in learning new information and recalling existing memories. Some medications block or reduce the activity of acetylcholine as part of their intended medical effect. Unfortunately, when acetylcholine levels are lowered in the brain, people may begin to experience forgetfulness, confusion, difficulty concentrating, and slower mental processing. These symptoms can sometimes resemble the early stages of dementia, creating concern for both patients and their families. Other medications may affect brain function by causing excessive sedation or by altering the balance of neurotransmitters responsible for alertness and attention. When the brain is constantly exposed to these effects, mental sharpness may gradually decline. Individuals may notice that they struggle to follow conversations, remember appointments, retain new information, or perform tasks that once felt simple and automatic. The risk becomes even greater when multiple medications affecting the brain are taken together. Drug interactions can amplify cognitive side effects and make it harder for the brain to function efficiently. Age-related changes in metabolism can also increase the amount of medication circulating in the body, making older adults particularly vulnerable to these effects. Understanding how medications influence brain chemistry helps explain why some drugs are associated with memory problems and cognitive decline, highlighting the importance of regular medication reviews, careful monitoring of symptoms, informed discussions with healthcare providers, and ongoing efforts to preserve long-term brain health and cognitive performance. Among the medications most frequently discussed in relation to cognitive decline are sleeping pills and anti-anxiety drugs. Millions of people rely on these medications to manage insomnia, stress, panic attacks, and other conditions that can significantly affect quality of life. While these treatments can provide short-term relief and improve daily functioning, growing research has raised concerns about their potential impact on memory and brain health when used regularly over extended periods. Many sleeping medications and anti-anxiety drugs work by slowing activity within the central nervous system. This calming effect can help people fall asleep more easily or feel less anxious during stressful situations. However, the same mechanism that produces relaxation can also affect areas of the brain responsible for learning, memory formation, and concentration. Some individuals notice that they feel mentally sluggish, forgetful, or less alert after taking these medications. Others may experience difficulty recalling recent events, remembering conversations, or retaining new information. The concern becomes more significant when these medications are used for months or years. Several studies have suggested an association between long-term use of certain sedative medications and an increased risk of cognitive impairment. Although researchers continue to investigate the exact relationship, many experts believe that prolonged exposure to these drugs may contribute to changes in brain function that become more noticeable with age. Older adults may be particularly vulnerable because their bodies process medications more slowly, allowing the effects to last longer and accumulate over time. Another challenge is that memory problems caused by these medications can develop gradually. People may assume their symptoms are simply part of normal aging and never consider that a prescription drug could be contributing to the issue. This makes awareness especially important. Anyone taking sleeping pills or anti-anxiety medications should understand the potential cognitive risks, monitor changes in memory or thinking, discuss concerns with a healthcare professional, explore appropriate alternatives when available, and carefully balance symptom relief with the goal of maintaining long-term brain health and mental clarity. Many people are surprised to learn that some medications used for allergies, bladder problems, and chronic pain have been linked to memory issues and cognitive decline. These drugs are commonly prescribed and are often considered routine treatments, yet their effects on the brain can sometimes be significant, particularly when used frequently or for long periods. Because these medications are so widely available, many individuals never suspect that they could be contributing to forgetfulness, confusion, or mental fog. A major concern involves medications with anticholinergic properties. These drugs work by blocking the action of acetylcholine, a neurotransmitter that plays a critical role in learning, memory, and communication between brain cells. Many allergy medications, especially older antihistamines, as well as certain treatments for overactive bladder, contain anticholinergic effects. While these medications may effectively relieve symptoms such as sneezing, itching, or urinary urgency, they can also interfere with normal brain function. As a result, some people experience difficulty concentrating, slower thinking, memory lapses, or increased confusion. Certain pain medications can also affect cognitive performance. Strong pain relievers may alter the way the brain processes information, leading to drowsiness, reduced alertness, and impaired memory. In some individuals, especially older adults, these effects can become more pronounced and may resemble symptoms commonly associated with dementia. The risk may increase when pain medications are combined with other drugs that influence the central nervous system. What makes this issue particularly concerning is that the effects often develop slowly. A person may not notice subtle changes in memory or thinking until the symptoms become more disruptive. Family members may observe increasing forgetfulness or confusion before the individual recognizes a problem. Understanding the potential impact of allergy, bladder, and pain medications on brain health is an important step toward protecting cognitive function, encouraging regular medication reviews, identifying unnecessary drug exposure, considering safer treatment options when appropriate, reducing avoidable risks, and supporting healthier brain aging throughout life. One of the biggest challenges with medication-related cognitive decline is that the warning signs are often subtle at first. Many people assume that occasional forgetfulness, difficulty concentrating, or mental fatigue are simply normal parts of aging, stress, or a busy lifestyle. As a result, they may overlook important clues that a medication is affecting their brain function. Recognizing these early signs can make a significant difference because cognitive side effects may improve when the underlying cause is identified and addressed appropriately. One of the earliest warning signs is an increase in everyday forgetfulness. A person may begin misplacing items more frequently, forgetting appointments, repeating questions, or struggling to remember recent conversations. While everyone experiences occasional memory lapses, a noticeable change from a person's usual mental performance deserves attention. Another common sign is difficulty concentrating. Tasks that once required little effort may suddenly feel challenging, and it may become harder to follow discussions, read for extended periods, or stay focused on important activities. Mental fog is another symptom often associated with medication-related cognitive problems. People frequently describe this feeling as thinking through a cloud, where thoughts seem slower and less organized than before. Decision-making may become more difficult, and simple tasks may take longer to complete. Some individuals also experience confusion, especially in unfamiliar situations, or find themselves struggling to find the right words during conversations. Changes in mood and behavior can sometimes accompany cognitive symptoms as well. Increased irritability, unusual fatigue, reduced motivation, or social withdrawal may occur when medications affect brain function. Family members and close friends are often the first to notice these changes because they observe gradual differences in daily behavior over time. Paying attention to these warning signs does not mean stopping any prescribed medication without medical guidance. Instead, it highlights the importance of discussing concerns with a healthcare professional, reviewing current medications regularly, evaluating possible side effects, identifying contributing factors, protecting cognitive function, improving overall quality of life, and maintaining long-term brain health through informed and proactive healthcare decisions. Protecting brain health does not always mean avoiding medications altogether. In many cases, medications play an essential role in managing serious medical conditions and improving quality of life. The goal is not to create fear about treatment, but to encourage informed decisions and careful evaluation of potential risks and benefits. Understanding that some medications may affect memory and cognitive function allows individuals and healthcare providers to work together to find the safest and most effective approach for long-term health. One of the most important steps is scheduling regular medication reviews. Many people continue taking medications for years without reassessing whether they are still necessary or whether safer alternatives have become available. A healthcare provider can evaluate current prescriptions, identify medications that may contribute to cognitive side effects, and determine whether dosage adjustments or alternative treatments may be appropriate. Even small changes can sometimes reduce unwanted effects on memory and mental clarity. Lifestyle strategies can also play a powerful role in supporting brain health. Regular physical activity improves blood flow to the brain and helps maintain cognitive function as people age. A balanced diet rich in fruits, vegetables, healthy fats, and nutrient-dense foods provides the brain with essential nutrients needed for optimal performance. Quality sleep, stress management, social engagement, and mentally stimulating activities such as reading, learning new skills, and solving puzzles can further support cognitive resilience. It is equally important to communicate openly with healthcare professionals about any changes in memory, concentration, or thinking ability. Many individuals hesitate to mention these symptoms because they assume they are a normal part of aging. However, identifying potential medication-related causes early may help prevent further cognitive difficulties and improve overall well-being. By staying informed, asking questions about prescribed treatments, monitoring cognitive changes carefully, exploring safer alternatives when appropriate, adopting brain-healthy habits, and maintaining regular medical follow-up, individuals can take meaningful steps toward preserving memory, protecting cognitive function, and supporting lifelong brain health. Here's Here's the final conclusion for your speech. As we conclude, it is important to remember that dementia and memory loss are not always caused by aging alone. Sometimes, the medications we trust to improve our health may have unintended effects on the brain, especially when used for long periods or in combination with other drugs. Today, we explored how certain sleeping pills, anti-anxiety medications, allergy treatments, bladder medications, pain relievers, and other commonly used drugs may contribute to cognitive decline, memory problems, and symptoms that can resemble dementia. The purpose of this discussion is not to create fear or encourage anyone to stop taking prescribed medications. Instead, it is to empower you with knowledge. Understanding the potential risks associated with certain medications allows you to become a more informed and active participant in your healthcare decisions. Small changes, such as reviewing medications regularly, reporting new memory concerns, and discussing safer alternatives with your healthcare provider, can make a meaningful difference in protecting brain health. Your brain is one of the most valuable organs in your body. Every memory, every experience, every skill, and every relationship depends on its ability to function properly. Taking steps to protect cognitive health today may help preserve mental sharpness and independence for years to come. If you found this information helpful, share it with your family and friends, because someone you care about may be experiencing memory problems without realizing that a medication could be contributing to the issue. Awareness is often the first step toward prevention, better health decisions, and a healthier future.